Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. We all sometimes don't eat our best. Is that making you unhealthy? There are ways and there are people that can help you make better choices with your food to bring you better health. And today we're talking with Jenna Rose, a registered dietitian, about that and about how these nutrition services can benefit you. Thanks for being here.
Thank you.
Talk to me about what exactly nutrition services are.
Well, nutrition is a critical part of health and development. And so nutrition services are basically educating and counseling patients about their diets. And this can be for somebody who maybe just wants to learn to eat healthier, or this could also be for somebody who maybe has a chronic disease and it's going to be part of their treatment plan.
Okay, so let's talk about that. Some chronic health conditions. What can those small diet tweaks do for you, and what kind of conditions are you talking about?
Well, for chronic disease management, we're talking about diseases such as high cholesterol, diabetes, hypertension, and we know that diet can improve the health outcomes of these diseases. And so with nutrition education, what can occur is it makes a patient feel empowered. By meeting with a registered dietitian, they can learn what foods are appropriate for their disease state and what they should eat or should avoid or limit at least. And so we know that with chronic disease management, if we can modify nutrition, that it can help slow down disease progression and sometimes ultimately lead to not have to take medications or taking less of a medication.
Diet can play such a big role in all of that. Everyone wants to lose a little bit of weight, right? So how can a dietitian or nutrition services help you in your weight management goals?
Right. Well, we know that nutrition and physical activity are key components to weight management. But a registered dietitian can help assess a nutritional status of an individual and help determine calorie needs. They can also provide them tips for eating more well-balanced meals, meal planning, meal prep, providing them behavior techniques like putting down your fork in between bites.
Yeah, small changes that end up with some big results eventually. I know my family is very guilty of this. We eat a lot of processed food, a lot of fast food. What are your suggestions on that?
Yeah, it's really challenging for families right now, especially with the cost of groceries increasing too. But there are some simple things that families can do just to try to balance those processed foods out in their diet. One simple thing that families can look at is increasing fruits and vegetables in their diet, but buying those fruits and vegetables that's in season. There's fruits and vegetables throughout the year that will be in season or not in season. And if you can find those fruits and vegetables that are in season, they tend to be less expensive while they're in season. Also, don't underestimate the health benefits of canned and frozen fruits and vegetables. That can be a convenient way to add those into your diet.
And not watch them go bad in your fridge.
Exactly. So we talk about building a food pantry and buying some fresh, some frozen, some canned, for that exact reason. That way you always have those in your pantry. Also remember that canned fruits and vegetables can be packed in its own juice, packed in water, even have no added salt. So it's really important to look at those labels so you're getting the healthiest version of that canned fruit or vegetable. Another thing that you can do to help decrease on processed foods is with protein-rich foods, a lot of us think meat, fish, poultry, but don't leave out your plant-based proteins like beans, nuts, seeds. They have wonderful health benefits for our bodies, and a lot of times if you buy those products in bulk, that can save you money too.
Yeah, and that's really important these days for sure. So if you feel like you need nutrition services and you need some extra help and guidance, do you need a referral from your provider to see you?
Well, it kind of depends on what kind of services you're looking for through Valley Health. Valley Health has some prevention programs like the WIC program, which is a safety net program that we provide families with nutrition, nutritious foods, also nutrition counseling and lactation services, and it's more of a prevention program. And then we also have registered dietitians at the Valley Health Centers for chronic disease management, weight management, those types of services. And so your doctor can refer you to a registered dietitian at a Valley Health Center near you if you are looking for those chronic disease management services.
And there's always more information over on the website, valleyhealth.org.
Correct.
Okay, great. Thank you so much for being here. Such great information. We all need to do better with our diets for sure. Jenna, thank you. Thanks for being here for Valley Health Minutes. I'll see you next Monday.